Hi everyone, this is Dr. ABINAYA Balakrishnan and I'm here today to deliver a lecture on lasers, the precise slice. We live in a world where innovations are created each day and the simplest of ideas goes a long way. So one such suggestion or an idea was given by Albert Einstein, and the use of it in many fields has grown immensely since then. Later, this was elaborated on by Theodore Maiman in 1960. And in 1964, Patel was the one who developed a gas laser, which is a carbon dioxide laser, in oral and maxillofacial surgery. So it has an acronym, light amplification by stimulated emission of radiation. So the whole lecture is going to be on elaborating on this acronym. So the properties of laser include monochromatic light that is going to be produced, which means it's of the same color. It is coherent with the same energy, frequency, or wavelength. It is collimated, which means the rays that are produced are going to be parallel to each other. And because it is having such properties, the intensity of this is going to be increased and it is going to be amplified to produce a laser beam. So the basic principle lies in amplifying this signal or this energy, which is monochromatic, uniphasic, and coherent. So to understand this, we all know the structure of an atom contains protons and neutrons as the center, and these yellow lines or yellow dots that are circulating or orbiting around the nucleus are the electrons. So depending on how these electrons are going to interact with the photons or the energy outside or light outside, there is going to be production of laser light. So in lasers, the interaction is of three types. It's either absorption, spontaneous, or stimulated emission. So when the electron is in a lower energy state and there is an external energy or light or a photon from outside, this is going to absorb energy from the photon and go to a state of a high energy state. So this stays there, and because of absorption of radiation, and then slowly later when it loses energy moves down to the low energy state. So what happens in spontaneous emission is that the electron already is in the excited state or the higher energy state. When it absorbs a photon from outside, it is going to be pushed down to a low energy state, and when it's pushed down, it's going to emit a photon, which is similar to that of the incident photon in the first place. So what happens in stimulated emission is that, again, the electron is in the high energy state. The photon incident on the electron pushes it to the low energy state, and two photons, of which one is the incident photon and the second one which is produced by the energy transfer from the high energy state to the low energy state. So there are two photons that are produced in stimulated emission. So this happens with one electron. When multiple such electrons are there, there's going to be stimulated emission that is going to be produced. Because of the stimulated emission, this is going to be amplified and lasers are then going to be produced. So what is population inversion is that many electrons are there in the ground state, but imagine there are 50 electrons in the ground state. When there are excited electrons, these electrons move to a higher energy level, and the inversion of population here in the ground state, which means more the electrons in the ground state are moved to the high energy state, and there is inversion of population from here to here. The components of the laser, the main component here is the high reflection and the partial reflection mirror. Here in between is the lasing medium, where there is an excitation of the electrons or the atoms in the lasing medium. So when there is a stimulated emission that takes place here, it is going to be amplified by these two mirrors to produce a laser beam outside. So this is what happens. So the blue dots represent electrons in the ground state. Later on, when there is going to be an excitation, there is going to be purple dots appearing, which means the electrons go to the high energy state. Again, there is population inversion, meaning more the purple dots here, excited electrons, than that of the ground state electrons, or more the blue dots here, which means more the amount of excited electrons are pushed to the low energy state, producing two photons in case of stimulated emission and one photon in case of spontaneous emission. So the excited atom is the purple dot and the ground state atom is the blue dot. So more amount of atoms in the ground state, meaning more amount of photons that are released and a laser beam is produced. Emission modes of laser are continuous or gated or free running. So free running meaning for a short period there is going to be a high energy laser that is going to be produced and there is a break that is given in between. The lasers can either be focused or defocused, meaning the lasers coming out of the laser um, medium are either going to be divergent or they are used to cut, which means they are focused and they cut. If it is defocused and divergent, it is going to be ablated. So the laser that is used to cut, which means in the focused mode, can travel a little more deeper than the one that is divergent. So there are contact and non-contact modes wherein the laser tip is going to be in contact with that of the skin or not in contact with that of the skin. So if it is not in contact with that of the skin, there can be tissue interaction where there is reflection of the laser light. But if it is very much in contact with that of the skin, there is a high chance that it's going to travel deeper into the tissue. So the only disadvantage here is if there is going to be the laser tip is going to be very much in contact with that of the tissue, charred tissue is going to form all around it, which can be later removed with a water spray. So the laser type can be many. It can be gas laser such as carbon dioxide laser, neodymium, yttrium, aluminium and garnet, or erbium, yttrium, scandium, gallium and garnet, or erbium, yttrium, aluminium and garnet, argon lasers or diode lasers. So depending on the tissue it has its affinity to, you can use different types of lasers for different lesions. So for pigmented lesions, argon and diode lasers can be used, and they are most usually used in periodontal crown lengthening or recontouring of the gingiva, removal of hypertrophic tissues. Diode laser most usually is used also in photosimulation in case of aphthous and herpetic lesions. So the only laser that is most usually used to cut dental hard tissue is the erbium laser, and carbon dioxide lasers are used for soft tissue lesions, and the use is usually hemostasis. Depending on the power, they are divided into three, and more than 500 milliwatt is high power laser, from 250 to 500 intermediate power, and low power lasers are that below 250. So high power and intermediate lasers use thermal or heat as one of the um, main criteria to produce the effect, whereas low power lasers or soft or cool lasers do not use heat and they cause vasodilation and stimulation of molecular or biochemical processes and promote wound healing in use of low power lasers. So types of interactions can be photochemical and photoablation. Photochemical meaning when there is biostimulation, as in stimulation of the molecules, and promoting wound healing, meaning it can stimulate lymphocytes or areas of lesions where wound healing is necessary. It can stimulate the molecules that are necessary for wound healing. Photodynamic therapy. This is used in case of, as you can see in the picture, there is a tumor there. This can be used in case of oral potentially malignant diseases or tumors, wherein instead of excision there, you can induce or administer a photosensitizer molecule there. For example, it's methylene blue that can be induced there. So once the methylene blue is administered, you can produce a laser light in that region. This again is going to interact with the photosensitizer molecule and then produce reactive oxygen species in the area and promoting necrosis and apoptosis only in that region, leaving the normal tissue intact, and the healing is promoted. In photoablation, the lasers interact with that of the tissue depending on the water content in the tissue. So if the tissue has a greater water content and the temperature of the laser is also greater than 100 degrees Celsius, there is vaporization and ablation that takes place in the region. So If it is more than 200 degrees Celsius, carbonization takes place, which is undesirable again. About 100 degrees Celsius, there is coagulation that takes place, and about 60 or slightly above 60, there is denaturation of protein takes place. So depending on the tissue there, depending on the water content, and depending on what the effect you need, you can increase the temperature, and the lasers can be used here. In oral mucosal lesions, lasers here in aphthous ulcers, you have low-level lasers that can be used. So you treat it usually within the first 48 hours. And what happens in aphthous ulcers is you have 4 points, imaginary points, and then you move in circles towards the center, spiraling down towards the center. You do it for about 15 to 20 seconds, wait, and with a wet glove check if there is going to be pain intensity that has been reduced, or if the patient responds to you and if the pain is reduced or not. This can be done. So this is done in case of major aphthous ulcers or minor aphthous ulcers. In herpes lesions, high power lasers or low level lasers can be used. High power lasers are used in the stage where the lesion is still in the vesicle stage, and the low level laser can be used when the lesion is healing or in the stage of crusting. A low power laser can be used. A photodynamic therapy can also be applied here when methylene blue is one of the photosensitizers, like we already said. Lasers can be used to form a chemical reaction there. A photosensitizer, methylene blue, is preferred here because it has its affinity to the nucleic acid. There's absorption of the laser and production of reactive oxygen species. It's not widely used yet. So this is one of the healing, as in vesicular stage herpes lesions, and the healing can be visibly noted here after 10 days. In leukoplakia, depending on the size, you can decide as to how you manage it with the lasers. So lesions which cannot be managed with that of excision, in carbon dioxide lasers can be used in defocused mode. There can also be vaporization that can be done, but the only disadvantage is that the charred tissue cannot be sent for histopathological examination. So you can use carbon dioxide lasers in such cases, wherein you mark the outline by vaporization of the lesion, you lift it with a forceps, and then excise it again in the with the help of a laser. And this can be sent for histopathological examination. So as you can see, at the ventral surface of the tongue, there is a epikeratotic lesion, which can be excised with that of the laser. So there's another leukoplakic lesion, and the healing that can be seen, the granulation tissue, and the healing that can be seen within 4 weeks. So actinic cheilitis, again, this is a 5-year follow-up of the case, which can be seen with greater healing here. And oral lichen planus, these 2 lesions can be managed similar to that of leukoplakia, wherein vaporization with which the outline can be marked and can be excised from underneath. Submucous fibrosis, when lasers have proven to be useful because when surgery is done, there is going to be scarring, furthermore promoting fibrosis and not very much improved mouth opening for these patients. So in such cases, the bands can be excised using lasers, and there is better wound healing in such cases and minimal scarring. In case of oral papillomas and inflammatory fibrous hyperplasias, also this can be used, but one disadvantage or one consideration here is the contamination of the area or of that of the air, because there is going to be laser plumes that are going to be produced. So care should be taken, proper irrigation, laser plume masks to be given to the operator. So this is one squamous papilloma that has been removed with the help of a laser. Look at the healing here with no scarring. So this is a fibrous hyperplasia here, inflammatory fibrous hyperplasia, which has been removed with the help of a laser. This is an area, the hyperplasia, that has been removed with the help of ablation because it's a wider area. So again, pyogenic plasma, areas where there are going to be increased bleeding the lasers are the best option. A mucosal, wherein there is not going to be much pain, but for aesthetic purposes, the patient wants to remove it, a laser is a better option. In burning mouth syndrome, weekly sessions of low-level laser therapy can be given. So points are marked with 1 centimeter gap in the oral mucosa, and each point should be precise, and the affected area is cleaned before you give them low-level laser therapy. And after each session, in the VAS scale, the patient is asked to rate the pain. So as you can see here in the tongue, in the lower lip, as well as in the ridge, there are going to be areas 1 centimeter apart wherein low-level laser therapy is given. It's proven to be useful in such cases. In salivary gland studies, low-level laser therapy can be given in cases of hyperfunction or xerostomia, and it shows promising results, and it is an efficacious method for improving the quality and increasing the quantity of the saliva. So it can be done on patients after chemo and radiotherapy as well, but it has to be studied even more. So the safety is important for lasers. First and foremost, you have to wear eyewear, and prevention of possible of exposure to infectious pathogens because of the plumes that are produced. They have a laser safety officer who can come in and check when you have a laser that is used. A fiber optic laser or a freehand laser, all the tips must be cleaned. So it should be a controlled area with solid walls and locked doors, with proper clothing and anti-fire explosive, because yes, fire accidents can happen even with lasers. So laser filtration masks for airborne contamination can be given. So the laser, because of its advantages, can be used because it has a dry area and minimal bleeding. Because of all this, lasers can be used, promotes wound healing, faster healing. The only disadvantage is that it's slightly expensive, far more expensive than actually doing surgery. So it is one main discovery that has to be furthermore studied, and its use is great, and it is going to be used in far more oral lesions when it comes to dentistry. Thank you.